cytomegalovirus retinitis is one of the common opportunistic ocular infections in immunocompromised patients. But recently, there are also reports of CMV retinitis in immunocompetent patients. The ocular prognosis of these patients is not severe, and retinitis is usually treated successfully by antiviral treatment of gancyclobion. Here, we report a case of CMV retinitis in an immunocompetent patient. He was resistant to antiviral treatment, and later, during the observation, metastatic liver cancer was detected. The case was a 74-year-old Japanese man. He had well-controlled type 2 diabetes and a history of colon cancer, which underwent successful surgical treatment in 2008. In April 2011, his left eye was diagnosed with uveitis and received posterior sub-Tenon injection of triamcinolone acetonide. Due to aggravation of retinitis, he was referred to our clinic. Figure 1 is the patient's left eye on April 1st, which was before the injection. Figure 2 is of May 6th, which was 26 days after the injection. Aggravation of retinitis was observed. In blood examination, CMV IgG and HCLV1 antibody were positive. The result of PCR of the aqueous fluid was positive for CMV DNA. As his left eye was diagnosed with CMV retinitis, he was referred to an internist for systemic investigation before antiviral treatment, but nothing abnormal was detected. The graph shows the course of treatment the patient received. An arrow shows sub-Tenon injection of triamcinolone acetonide. The dots show intravitreal gancyclobion injection. Bars show oral valganciclobion. Despite antiviral treatment, retinitis was not resolved, and metastatic liver cancer was detected in June 2012. The patient passed away not long afterwards. When CMV retinitis is resistant to antiviral treatment like this case, it is important for ophthalmologists to keep systemic investigation for occult malignancy. I am Dr. Yumiko Yamamoto at Department of Ophthalmology and Visual Science, Kochi Medical School, Japan. Thank you for your kind attention.